At the 2011 ONS conference in Boston, Massachusetts, we're going to discuss unmet information needs and quality of life in young breast cancer survivors in Japan. And joining us to do that is Dr. Mika Miyashita from Hiroshima University in Japan.
Yeah.
Thank you.
Thank you. Thank you so much.
So, why are you studying young breast cancer survivors?
Breast cancer is the most common cancer in Japan.
Breast cancer is the most common cancer among Japanese women. The trend of the incident rates is the same among Japanese and U.S. women under 50 years of age. Since young breast cancer survivors have age-specific problems, we should provide support which meets their age-specific needs. The breast tumors in young breast cancer patients tend to be more aggressive and have a greater effect negatively on quality of life. Recently, at least 4 studies about young breast cancer patients have started in Japan. So we begin to investigate specific needs in young breast cancer survivors and prepare to construct a system of care.
What do you think is the most critical problem in providing information to young breast cancer survivors in Japan?
In
our survey, the most unmet need is communication with medical professionals, which is not a specific problem among young breast cancer survivors. The main reason for being unsatisfied in communicating with medical professionals is they mentioned that their physician or nurses looked so busy, and their physician changed frequently to another doctor. The result of our study indicated that 26.4% of the respondents did not receive advice for strategies about communication with medical professionals, and 22.9% of the respondents were unsatisfied with the information. This data suggested that we should support physicians and nurses so that they have enough time to communicate with patients and teach communication strategies to patients.
Can you discuss symptom management?
As to specific
symptom management in young breast cancer survivors, 70.2% of respondents had hormonal therapy, and 42.6% of these respondents reported menopausal disorder. The symptom reported most frequently were hot flushes, which was reported by 80% of respondents with menopausal disorder. To clarify the relationship between satisfaction with the information about secondary menopause and quality of life, we conducted a t-test. The result of analysis indicated that there were significant differences in the mean scores of the physical and psychological domain of quality of life measurement between satisfied and unsatisfied patients. Oncology nurses should enhance the coping ability of patients by providing the information about menopausal disorder to patients who have hormonal therapy.
Doctor, is it important to establish a stronger support system for young breast cancer survivors in Japan?
In Japan,
people can get information easily through the internet. However, cancer survivors are sometimes confused by information. Oncology nurses are to teach and support patients through evidence-based practice. In the near future, we will integrate evidence, which is being made through several studies currently, and establish a support system for young breast cancer survivors.
Doctor, thanks for stopping by and sharing the information of your work with us. We appreciate it.
Thank you.